we'll talk about lymphoma. So lymphoma, similar to leukemia, is also a malignancy. So many students confuse between the pathogenesis of leukemia and lymphoma. So let me make it very clear. So lymphoma is a malignancy of the lymphocytes which present as tissue masses. Unlike what happens in lymphoid leukemias, where there will be leukocytosis or the WBC count is in the extent of lakhs, lymphoma, it's a malignant proliferation of the lymphocytes which presents as tissue masses. And these lymphomas are simply classified into Hodgkin's and non-Hodgkin. Hodgkin's is something like a topper. So Hodgkin's always is a disciplined, well-mannered malignancy. So Hodgkin's lymphoma always is confined to the lymph nodes. It spreads in a sequential order. Say for example, if you come and the most common lymph node, as you already know, is the cervical lymph node. If you come across a person with Hodgkin's, first involves the right cervical, then it involves the left cervical, then into the mediastinal, then into the abdominal. So it spreads in a sequential order. And never ever Hodgkin's causes extranodal spread. So it doesn't involve the extranodal lymphoid tissues like the malt, Waldeyer's, tonsils and all. These also will not be involved in Hodgkin's lymphoma, and it never has any peripheral blood spillover or the bone marrow involvement. The reason why Hodgkin's lymphoma is always of good prognosis. If you are very good at knowing the Hodgkin's lymphoma things, it is very easy. Whatever opposite to Hodgkin's will be a non-Hodgkin. So non-Hodgkin's is a lymphoma. Non-Hodgkin's lymphoma is a lymphoma which doesn't spread sequentially. It has a haphazard spread. It is not confined to the lymph node. It can also involve the extranodal spread. It can involve the spleen. It can involve the thymus. It can involve the malt tissue. It can involve the Waldeyer's, tonsils, and everything will be involved. The reason why non-Hodgkin's lymphoma is of poor prognosis.